My name is Preeti, and I am a PhD candidate at the University of Calgary. My poster is about alcohol and substance use in pregnancy during the COVID-19 pandemic. In the next few slides, I will walk you through each section of my poster. There is extensive research suggesting that alcohol and substance use in pregnancy are related to poor perinatal and neurodevelopmental outcomes. There are a number of factors associated with use during pregnancy, such as mental health challenges and financial difficulties. Both of these factors have worsened tremendously during the COVID-19 pandemic, given the social distancing measures and disruptions to employment and economy. This led us to investigate alcohol, cannabis, tobacco, and illicit drug use among pregnant individuals during the COVID-19 pandemic to understand patterns of use, mental health predictors of use, and COVID-19 predictors of use. Now for our methods. This analysis includes a cohort from the ongoing study Pregnancy during the COVID-19 pandemic. Participants were all living in Canada, older than 17, at least 35 weeks pregnant, and could read and write in English or French. Between April and September, we had over 7,000 participants complete an online intake survey and over 3,700 participants complete at least one follow-up. Specifically, the survey asked about alcohol and substance use, symptoms of depression and anxiety, as well as a number of COVID-19 concerns. These included worries about COVID-19 threatening their baby's life, mom and baby not receiving the care they need, feelings of social isolation, and financial difficulties. Lastly, for our statistical analysis, we tested whether mental health and COVID-19 factors were associated with alcohol and substance use at intake. And then, we also tested whether these circumstances at intake predicted future alcohol and substance use at the follow-up. This table is a summary of our sample. As we can see, levels of income and education were higher than Canadian averages. As well, the percent of clinically elevated symptoms of mental health were considerably higher than averages reported in previous studies before the pandemic. This figure summarizes every combination of alcohol and substance use. 12.4% of pregnant individuals were using at least one substance. Overall rates were 6.6% for alcohol, 4.3% for cannabis, 4.9% for tobacco, and 0.3% for illicit drugs. For our remaining results, we found that clinically elevated symptoms of depression and anxiety were associated with cannabis and tobacco use at intake and in the future at follow-up. We also found that less worry about COVID-19 threatening their baby's life increased odds for alcohol use throughout pregnancy. As well, more financial difficulties increased odds for cannabis and tobacco use throughout pregnancy. To interpret our results, we found that cannabis use rates are comparable to previous estimates, whereas rates for alcohol, tobacco, and illicit drugs are lower. This may reflect the socio-demographic profile of our sample, as previous work associates lower income and lower education with use during pregnancy. Or perhaps this reflects fewer opportunities to use during the pandemic. We also found that clinically elevated symptoms of mental health were associated with substance use throughout pregnancy, which aligns well with previous research prior to the pandemic. It's possible that substance use is a coping mechanism for pandemic-related circumstances, like financial difficulties, or it may just be a more accessible option if more time is spent at home. For the results showing that alcohol use was associated with less concern about COVID-19 threatening their baby, this may reflect less concern about their pregnancy overall. All this to reiterate a critical need for comprehensive care, including screening, education, and access to perinatal, mental health, and financial supports, especially during the pandemic. Thank you so much for listening and checking out my poster. Please feel free to reach out if you have any questions.